Hello, my name is Dr. Brandon Gardner. I'm a general dentist here in Boerne, Texas, and today I'm talking with my good friend, Dr. Adam Harkrider. Dr. Harkrider is an endodontist who practices here in Boerne, Texas as well. He is a diplomat of the American Board of Endodontists, and before specializing in endodontics, Dr. Harkrider served as a dentist in the U.S. Navy, and I'm very grateful to have him join me as my guest today. Dr. Harkrider, welcome.
Hey, thank you, Brandon. It's good to be here.
So, Dr. Harkrider, what is an endodontist? I feel like I have to explain that term sometimes to my patients.
Yeah, it's I think you made the comment before that a lot of people know what a root canal is, and not many people know what an endodontist is. And basically, an endodontist is someone who specializes in root canals. And while I was in the Navy, I did 2 additional years of residency in DC to specialize and to learn all things root canals. So that's essentially what it is. I do root canals or root canal related procedures all day, every day.
So it's true. I talk to a lot of patients who have heard the term root canal, but I find that fewer of them really understand what is a root canal. Maybe you can tell us a little bit about what exactly is a root canal.
Sure. Yeah, a root canal is something that is required when someone has a problem inside the roots of their tooth that's causing them pain or infection. Swelling could be involved as well. And it's a procedure that we do to eliminate the problem, the source of the pain, the source of the infection, the source of the swelling, and allows the patient to maintain their natural tooth in a state of health. And then they can start to function on it again. And just to give you a quick summary of, kind of the anatomy of the tooth, and this is what I typically tell patients is there's little spaces that course through the root structure of your teeth, and inside those spaces there's nerves and blood vessels. And when a problem happens with those nerves and blood vessels, they start developing inflammation, or the nerves inside those spaces start to die off. You'll get inflamed tissue and or dead tissue and bacterial infiltration into those spaces. And so root canal is essentially accessing those spaces inside the roots, cleaning those spaces out, and eliminating the source of the inflammation or infection. And once out, we seal those spaces up.
Gotcha. So you mentioned something in there. Patients that may end up needing a root canal may be those who are having a toothache, some pain, or maybe an abscess or some swelling. Those are some of the more common reasons we see for having a root canal.
Exactly. Yep. So if they have a deep cavity that's encroaching on the spaces inside the tooth where the nerves are, that can create inflammation that will become painful. And in those instances, we have to remove that inflamed tissue, the inflamed nerves. If the nerve has undergone a lot of trauma through past dental work, fillings, crowns, cracks, things like that, and has kind of died off, and there's dead tissue inside the roots, that would be another indication. For doing a root canal, we would need to remove the dead nerve that's inside the tooth, and clean everything out and seal it up, and that will eliminate the source of the problem, and again, get the tooth back to a state of health and function.
Perfect. Thanks for explaining that a little bit more. Now, root canals have a bad reputation. It's like a root canal is 2 words, but it's when people talk about them, it's like a 4-letter word. It's a bad thing, However, most patient experiences with root canals are positive. Maybe you can tell us a little bit more about why they have a bad reputation, and really what is a realistic expectation a patient should have if they need a root canal.
Yeah, no, that's a great point, and probably half the battle when patients come to my office is getting them over that psychological hump, of how awful that they perceive it to be, and sometimes previous root canals can either be a benefit or a detriment to that belief that it's bad. So if they had a good experience, they come in, it's no big deal, they know what to expect. If they've had a bad experience in the past, though, they come in and they're super, super fearful because they're afraid they're going to have another bad experience. But I think in the past, root canals have been around for probably a century or a little bit more maybe. And for the first, 60, 70 years of root canal treatment, we didn't have great materials, didn't have great techniques and great instruments at our disposal to make it as smooth as we do now. Now we have really good instruments, really good techniques, really good anesthetic techniques as well. So nowadays it can be a pretty relatively quick procedure. Should be painless. Most of the time it is. But in our office, you come in and everybody's very, very friendly, very nice. You're greeted, like a VIP. We do everything we can to make you feel at home and comfortable. We do a couple things also once you get into the operatory. First of all, we're going to get you very, very numb. So you really shouldn't feel anything during the procedure. And anybody who does, we stop immediately and take steps to get you more anesthetized. We also have a TV that's mounted on the ceiling. So right above you while you're laid back watching or getting your root canal, you can watch a show. We give you a set of headphones to plug into a remote control, and a lot of people really like that because part of the fear is the sounds and the noises that are happening. So we go to extra lengths to try to make people as comfortable and calm as we can.
That's great. I know we send you a lot of patients, and they always come back very pleasantly surprised that it wasn't as bad as they were thinking, or it was actually pretty easy for them.
Well, good. Thank you.
Yeah. So very often folks that need a root canal may be faced with the decision of, is it worth investing the time and money into trying to save a tooth that's in really bad shape? And, sometimes we're faced between a choice of, do we fix this tooth with a so-so result, or do we extract the tooth and maybe do a dental implant? What are some of the things that maybe might help patients make that choice of which route to go?
Yeah, I think that's sometimes it can be a really difficult choice, and if it's a really tough gray area, obviously I'll spend some time discussing the pros and cons with the patient. You and I will talk about the case, and we'll communicate together and put our heads together and see if we can come up with the best plan. There's different philosophies on that, and ultimately, my philosophy is if we think we can get a decent amount of time, and for me personally, I look at a decade or so to be a pretty good benchmark out of the tooth. I believe that it's probably worth saving your natural tooth. You can't. There's really no replacement for it. So if you can maintain it and you can use it, then a root canal is a really good way to go. And if we think we can get somewhere around a decade out of it, if it's less than a decade, sometimes we're looking at compromised teeth that we really don't think we can get less than a decade, and it becomes a little more complicated then, and we have to take into account the finances. Obviously, a lot of times are an issue because implants can be a little bit more expensive. We want to also look at, how much the patient values their natural tooth, because I talk to some patients and they say, hey, if you can get 2 or 3 years out of it, that'd be great. And some patients say, if I can't get, 15 years out of it, I don't want to fool with it. I want to get something that's the most predictable. So, it's an array of different factors that we're looking at to try to hone in on what's best for each individual patient.
Yeah, I think that's a great point that you bring up. Looking at the pros and the cons and the return on the patient's investment and what they're going to be doing. And if we can get a solid 10 years, hey, that's 10 more years with your natural tooth. And maybe then in the future, we can talk about an implant if that's appropriate
Sure.
At that time. Well, Dr. Harkrider, thank you so much for your time this morning and for taking some time to talk with me. If you'd like to learn more about Dr. Harkrider, you can find him online at Harkrider Endodontics. Their website is harkriderendo.com. And I'm Dr. Brandon Gardner, and we're here at Gardner Springs Dentistry. Thanks.
Thanks, Brandon. Have a good one.